Cardiovascular conditions can significantly impact a person's ability to move comfortably and safely through everyday environments. For many individuals living with heart disease or related disorders, even short walks across parking lots can cause shortness of breath, chest discomfort, dizziness, or extreme fatigue. In these situations, a DMV handicap parking permit can provide meaningful support by reducing physical strain and improving accessibility. Heart-related conditions vary widely in severity and symptoms. Some individuals live with chronic heart failure, coronary artery disease, arrhythmias, cardiomyopathy, or other serious cardiovascular disorders. These conditions may limit how efficiently the heart pumps blood and oxygen throughout the body. As a result, physical exertion that once felt routine can become exhausting or even dangerous. Climbing stairs, walking long distances, or carrying groceries may trigger symptoms that require rest or medical attention. A disability permit is designed to address these challenges by granting access to designated, accessible parking spaces. These spaces are typically located closer to building entrances, minimizing the distance a person must walk. They are also wider than standard parking spaces, offering additional room for mobility aids and safer entry and exit from vehicles. For individuals with cardiovascular limitations, the reduced distance and improved safety can help conserve energy and decrease the risk of overexertion. Eligibility for a disability permit based on cardiovascular conditions depends on state-specific medical criteria. Generally, an applicant must demonstrate that their heart condition substantially limits mobility or the ability to walk a defined distance without stopping to rest. Some states consider factors such as the need for supplemental oxygen, severe functional limitations confirmed by a physician, or documented cardiac classifications that indicate significant impairment. Medical certification is a required part of the application process. A licensed healthcare provider must evaluate the individual's condition and confirm that it meets the legal definition for a disability permit. This ensures that permits are issued based on documented medical need. Clear communication with the physician is important so that symptoms and limitations are accurately described on the application. States typically offer two types of permits: temporary and permanent. A temporary permit may be appropriate for individuals recovering from heart surgery, a recent cardiac event, or a short-term worsening of symptoms. These permits have expiration dates and may require updated medical certification for renewal. Permanent permits are generally issued for chronic or progressive cardiovascular conditions that are not expected to improve significantly over time. The application process usually involves completing a state-specific form, obtaining medical certification, and submitting the documentation to the appropriate motor vehicle agency. Some states allow online submissions, while others require applications to be mailed or delivered in person. Processing times vary, but once approved, the permit is issued and must be displayed properly when parking in accessible spaces. It is important to understand that a disability permit may only be used when the eligible individual is present in the vehicle. Allowing others to use the permit without the qualifying person present can result in fines, penalties, or revocation. Respecting these rules helps ensure that accessible parking remains available for those who genuinely need it. Beyond physical relief, a disability permit can also reduce anxiety. Individuals with serious heart conditions often need to carefully manage energy levels and avoid unnecessary stress. Knowing that accessible parking is available provides reassurance and allows better planning for appointments, errands, and social activities. It can make attending cardiac rehabilitation sessions, doctor visits, or routine errands more manageable. For many people with cardiovascular disease, independence is closely tied to mobility. The ability to drive and access community spaces supports mental health and social connection. When physical limitations interfere with mobility, accommodations such as accessible parking become critical. A disability permit serves as one part of a broader support system that helps individuals maintain autonomy while managing their condition responsibly. It is also important to recognize that not all heart conditions are visible to others. Someone may appear healthy while experiencing significant internal limitations. Education and awareness can help reduce misconceptions about who qualifies for accessible parking. Eligibility is determined by medical standards, not outward appearance. In addition to obtaining a permit, individuals with cardiovascular conditions should consider overall safety when driving. Fatigue, medication side effects, or sudden symptoms can affect alertness. Regular communication with healthcare providers ensures that driving remains safe and appropriate. In some cases, lifestyle adjustments, cardiac rehabilitation, and treatment improvements may positively influence mobility over time. Renewal of a permit requires attention to expiration dates. Temporary permits, in particular, must be renewed if the qualifying condition persists. Keeping copies of medical documentation and setting reminders for renewal deadlines can help prevent lapses in access to accessible parking. Ultimately, a DMV handicap parking permit for cardiovascular conditions is more than a parking accommodation. It represents a practical tool that supports health, safety, and daily participation. By reducing walking distance and physical strain, it allows individuals to conserve energy for meaningful activities and essential responsibilities. Living with a heart condition requires careful balance between activity and rest. Accessible parking contributes to that balance by removing unnecessary physical demands. Through proper medical certification, responsible use, and awareness of state regulations, individuals with cardiovascular limitations can benefit from the accessibility and independence that a disability permit provides. In this way, accessible parking becomes part of a larger commitment to inclusion and health-conscious living. It acknowledges that mobility challenges are not limited to visible injuries or mobility devices. For those managing serious heart conditions, a disability permit can make everyday life safer, more manageable, and more dignified. We hope this video helped answer your questions. If you need a handicapped placard or plate and want to avoid the confusion and long wait times, visit handicappedparking.com. Our licensed doctors are available online to help you from the comfort of your home, making the process simple and stress-free. Subscribe for more helpful information on disabled parking permits, and leave a comment if you have any questions. Thanks for watching, and we'll see you in the next video.